Hello, and welcome to the second episode of my podcast, Cancer: A Personal Journey, with the intrepid Julia Maria Seemann, who in our episode one described her experience getting the diagnosis of cancer and has agreed to share her experiences with us. As I mentioned again in the first episode, we're not aiming to talk about personalities or persons involved so much in treatment, but really to dissect and understand the impact of illness, the impact of cancer in particular on you. I think we ended our last session talking about the fact that you had to shave your head, and that, for a woman, that's a pretty monumental thing to do, as it involves your vision of yourself and your self-worth and everything. But we also talked about the kind of a flurry of activity that occurred when you got the diagnosis, the anxiety you had when you experienced it, and the uncertainty and unknowing about what the future would bring. And I think that was last December when all this happened, in early January. So here we are now approaching almost a year. And I can say that I think that you have been seeing a healthcare professional or in the hospital at least twice a week, virtually every week since that time. Is that correct?
Yeah, that's correct.
And now you're in the midst of your second 12 weeks of chemo, and we'll get to that as we go further in the series. But before we begin, I'd like to say again, uh, uh, anyone who wishes to donate to the cause can find just a link in the description box below the video to help Julia get back on her feet. And otherwise, we're going to really just spontaneously talk and let things rip and see where we go. So let's go back then to last January. And you had the diagnosis that you had a breast mass, and then you had a number of scans, correct?
Mhm.
You had mammography, and then an ultrasound, and um, and then you, in anticipation of what you were told, which is that you have to have chemo, you shaved your head.
Mhm.
So can you remember back to January and what that was like for you?
That was probably one of the hardest times for me in the whole journey, because there were so many unknowns. I was very afraid of the chemotherapy and the effect that would have on the body. Um, my sister actually had to break up her chemotherapy because of the effect it had on her body. So I was really terrified of that.
And
And
I should say, you have a twin sister,
yes, yeah,
correct? And the reason that you even thought to check your own breast is because she called you and told you that she had found a breast mass. And she
yes,
lives
yeah,
all the way the other side of the world.
yes,
Right.
yeah,
Okay.
yeah. That's how it all started. And And so I had the date for the surgery then set for March. And before that, shortly before that, I had another biopsy for my left breast because they thought there might be something happening there as well. But before the results came back from that biopsy on my left breast, I already had the surgery planned. And so I kind of never really knew what the result would be. That was a strange
So
situation
what did you
also.
think was going to happen? Did you think you were going to lose your breast? Did you think you were going to, I mean, how were you processing all this?
Well, I knew that I was definitely going to lose my right breast and possibly a part of my left breast, depending on those results. And I think that whole time was kind of a state of shock because it was just so much to take in that I can't remember feeling so much about losing my breast. Yeah, I think I was in a state of shock really and just going through the motions at that time. Um, and I was fortunate actually to have had a really nice surgeon to talk to. And he is a very positive personality. And he just really made me feel that he would do his absolute best to make it look nice. I'm sorry, I'm getting emotional about this, but I was very touched by his enthusiasm and how he said, I'm gonna make it look nice for you. And the great surprise was for me also that he was able to perform, maybe that's too much information, but he was able to perform a nipple sparing mastectomy, which means I could keep my nipple, which kind of in a look makes a difference, I thought. And
So that was because the cancer hadn't traveled to that part of the breast,
yeah,
correct?
yeah.
So in a way, that was very lucky that, 'cause that's unusual, I
Mm.
think, pretty
Yeah,
much.
I think it's very unusual. Yeah. And so I was actually really just grateful for that. And yeah, he talked me through everything in this really positive manner, and that kind of rubbed off a little to me. It made me feel a lot better about the operation because I'm more the anxious type. So having a surgeon that's very optimistic was actually exactly what I needed, and really, really helped me throughout this whole process. Yeah,
And you also had a team. You had a breast nurse, a breast cancer nurse,
yeah,
who was sort of
yeah.
a hub, a person in the middle of a hub who could liaise with the surgeon and everybody else, I guess. Um, and you got the number of blood tests. Did you have any more ultrasounds after that
Um,
initial one where they did the biopsies?
Yes, I did have at least one or two more ultrasounds after that, because there was this great suspicion of my left breast, and that went on for quite a while. I went back to ultrasounds for that, and they said it's just because they wanted to avoid having that I would have to go through another biopsy for my left breast. So they tried to really figure it out through ultrasound before that. And so I think another two ones where they really tried to figure out, do we have to do that biopsy now on the left side or not? And that was very, of course, difficult because I was just hoping that she could say, "Oh, right, no, it's not cancer. Now we see it's not cancer. It's finished. It's done. We just go for the operation." But it just took such a long time, these ultrasounds. And she just looked and looked, and she called it another doctor. And then actually, the whole team of doctors gathered at some point because it just couldn't make sense out of my images whether it was cancer or
But
not.
they
It
did
just
take
couldn't
a
make sense.
biopsy, did they not?
Yeah, eventually
Say
they did
eventually.
take, yeah,
Yeah.
eventually after all these ultrasounds, that look, we
Mhm.
just can't say it for sure. So we have to do another biopsy on that side just to make sure that it's nothing. Which they then did, which was much lighter than the first one. I had a different doctor, and she was very, very good. And she just quickly went for that spot. She got it immediately, and it was all done. And she said, "I hope for the best for you, that it's nothing." And yeah, it was a much more positive experience than the first
And
one.
those results came back before the surgery, obviously, so they knew what they were going to do.
I'm not sure if I heard about them before the surgery because I thought it was so strange that that was so shortly before that. I can't actually remember it now, but um, I can't say for sure that I was told before the surgery, but maybe it must have been.
Yeah, I think
So
it must have been.
sorry.
Otherwise, they would have
Yeah,
said, no, we have to
yeah,
do the
yeah.
other breast. We have to. I'm just saying, make the whole shock of it is that as a man, I can't imagine. I mean, I'm a person I have a phobia about getting pierced or getting. I would never get a tattoo. I'd never get a piercing of any sort. But to have your body um, surgerized, cut, to me, it's a phenomenal thing, I think. And I can remember back, I had some very minor surgery when I was in medical school. And I remember it was to remove a little fatty cell tumor in my arm. And I remember being on the table and feeling absolutely, so helpless, kind of vulnerable. And I'm the kind of a tough guy. And there you are, you're prone and you don't know what the hell's going on. And that was minor. And here you are with this major operation that's going to affect the rest of your life. And that means you don't know about implants, you don't know what it's going to look like. But tell us a little bit, did the surgeon talk to you about what you could expect when he described what the operation would be?
Yeah, he was excellent. He just took all the time I needed. I never had the feeling I had to rush or he had to leave or the appointment was ended. He sat there all the time I needed to talk about everything and all the options to either not have an implant or have an implant. Because as an athlete, that's a question to consider. Because I also wanted to be able to be fit again as quickly as possible. And the implant needs some extra healing time and there's some possible complications. But in the end, we decided together, he helped me in that. He pushed me towards trying the implant. And I'm so grateful for that because, as I said, I'm naturally a more anxious person. And I'm so grateful that no, but it could be fine and it could look nice and it could all go well. And yeah, so I did decide to have the implant done. And I was also elated to learn that my left breast did not have cancer, which was a big, huge relief for me. The prospect of having both sides, something done to both of my breasts, of course, would have been much more also scary than just one side. So that was a really big relief for me. And just his positive attitude saying, "I'm going to make it look nice for you." And I said, "Okay, I trust you."
That's
Yeah.
beautiful.
Yeah.
And did they also talk to you about other kinds of therapies? For example, they did some testing on the type of tumor you had,
Yeah.
right? And you had a a hormone positive tumor,
Mhm.
and they advised some hormonal therapy initially. Is that correct?
Yeah, yeah, before because it took a while until I did have the surgery, probably longer than for some people. Um,
So
and
the
so
diagnosis was December. You had the
yes, yeah,
surgery March, so that's three
so
months
3 months,
later,
yeah, it's a long
which
time.
is kind of a long time. You think,
Especially if you have a more advanced cancer, which I do. It's a long time to wait. And so he suggested, or they suggested to for me to take a hormone blocker, tamoxifen, in that time prior to the operation so that it wouldn't grow or spread more. Which I was also very scared of taking because I, of course, read all the side effects that could have. And for some reason, yeah, I was very scared of taking tamoxifen. But I did take it, and I'm very, very glad because I do think that is really an important, very important factor when
but
you.
that changes your, did that change your physical experience when you took tamoxifen? Did it have effects on you? Uh,
I think I didn't take it so long to be able to really say that because I only took it maybe a month or something like that.
okay.
And that's not so long, so I'm not sure if I can really say much about how I would feel on it long term. But that for the time that I took it, I didn't have any side effects really, so it wasn't a problem at all.
And had anyone discussed the role of chemo before that? I mean, sometimes I've heard some people get chemo first, or even radiation first, and I'm not really so caught up on all. I don't know enough about the protocols these days. But were you expecting chemo first, or was this the flow that you expected? That you found the tumor, they did testing, and they were going to do what was obvious, which was to just get rid of the tumor surgically.
I think a lot of the times in my case, having stage 3 breast cancer, they do a chemotherapy before the surgery to reduce the size of it and make the operation easier and cleaner. And I think at some point the surgeon suggested that for me as well. And I remember that exactly that scene. He said, I think with you, we should start with some chemotherapy first. And I just immediately said no, because I was so scared. As I said, that was the most scary thing for me was the chemotherapy of all of it. More than,
What were you afraid
yeah.
of? What were you afraid of, like chemotherapy?
Oh, just the side effects. I remember just the thought of having poison go through my entire body was for me more scary than the cancer itself. Believe it or not, that's probably a bit strange, but yeah, I was just so scared of it. The effects on the bones, the effects on putting me into instant menopause, which is a huge thing as a woman. I was only 40, 3. I didn't want to go into menopause from one day to the next. And all these many, many side effects that I read about, I was very scared. And as I said, my sister had to break up her chemotherapy, so I didn't have a great feel about it. And I remember saying no right away. And from then on, it just was not a topic anymore. And retrospectively, I wonder maybe it would have been a good idea to have it first.
Well,
But
I mean, I know there are a lot of people who feel that chemotherapy is a very blunt instrument
mm,
because it's basically giving you something that kills all the growing, dividing cells in your body in the hopes that it kills the packet of cells of the tumor and the cancer, that are growing and dividing. So it's not a pretty targeted therapy, unlike some of the newer modalities,
yeah,
correct?
yeah.
So yeah, it's like trying to kill a fly with a shotgun, pretty much.
That's right. But now that I am going through chemotherapy, my opinion about this has changed actually dramatically. I have not suffered too much from it, apart from having extremely dry eyes and apologize. I'm blinking so much because of that all the time. Um, but I I know now that without the chemotherapy, I would not be in a good place, and I would not have a long life anymore. And that compared to the side effects that I'm experiencing, is definitely worth it. So I've really changed my opinion about it since I'm going through it. Yeah.
Well, we'll get to chemotherapy in one of the following
Mhm.
episodes too. So, but let's go back to the surgery. So you had meetings with the surgeon. He seemed to be a very reliable person, very upbeat person, talked about what he would do, and then planned the surgery. Do you remember feeling what it was? How did you feel the night before? I mean, some people go in and say, okay, I just got to get it done. Let me get in there, get it done, and whatever. How were you experiencing that moment, that night before surgery? You and your husband, for example.
Oh, I was really freaking out the day before. I was very scared, and until the last moment, I wasn't sure if I was actually going through with it. I had thoughts of not wanting to have the surgery, of just letting everything happen the way it does, and just not getting any treatment. I thought about that at length before the
You mean
surgery.
getting no treatment at all?
Yes,
I
yes,
mean, really, just
yeah.
saying what? You were in a,
Yeah. Yeah, because I was so scared of the treatment that I thought I'd rather just let everything happen because I'm a very natural person. I don't ever go to the doctor naturally, normally. I don't ever get anything, any flu shots or anything. I just want everything to just be natural. And so just the thought of all these treatments was freaking me out. And I thought until the last minute before the surgery, I really considered not even going
that's
there.
real, really.
Yeah, yeah. And yeah, and then I just let it happen. I just went to the surgery, and as I said, the doctors being so nice was a huge help in the process for me. It made all the difference for me. The kindness of the doctors, the brightness of the hospital,
And
and
did he, how long was the surgery? Do you remember how long it was? How many hours?
no, I can't remember. I remember we got there, and
I think you were first up that day for the surgeries, right? You were
yeah,
early in the morning.
yes, yeah.
Did you wake up that evening? And did the doctor make rounds that evening?
So before the surgery, the doctor looked at my breast again and discussed the operation with me again. And then I was quite calm actually. On the day of the surgery, I was very, very calm. I had no fear at all. I went into the operating theater, and I remember it was freezing cold in there. And they played a loud, upbeat music. It was really, I thought, oh my God, really? Yeah, like loud music, freezing cold. Several doctors were there, several nurses, and they just quickly put me on the table. And then one of the doctors who was going to put me under the
Anesthesia. Yeah.
anesthesia, he asked me something. He said, "What is spoon in German?" or something. I guess he wanted to talk about something very familiar to me to make me feel really comfortable.
Hmm.
So he talked about my language with me.
Yeah.
Well, I remember that last question was, what's how is spoon in German, the word for spoon?" And then he said something else, and I was just immediately,
So that's what
I
you
was,
remember.
yeah, I was,
You know, it's funny. I had general anesthesia once in my life, and that was when I was 4 or 5. I had my tonsils taken out, and I still remember being wheeled into the operating room and just losing awareness. You know, that's how it had a profound impact on me, that experience. But you got asked about how do you say spoon in German, by the way?
Löffel,
Löffel. Okay,
Löffel, yeah, yeah.
Löffel. And then you were out.
And then shortly after that, I was out. It was very quick, I remember. Yeah. And the next thing I remember is that I woke up in a room with other people and a nurse next to me. And I was just awake right away. There wasn't any moment in between or being a little
You were woozy.
paced
You
or
weren't.
no, nothing. I was just right away awake, totally awake,
Okay.
like normally awake.
Okay.
And yeah, and I felt really good. I guess maybe that was some of the medications I took, or I don't know, but I felt very calm. I felt really well. I didn't have any pain. And the nurse helped me to put my bra on. I remember I was feeling good. Yeah.
And and when did the surgeon see you that evening after the surgery or the next morning?
I think my God. I think that's that same day. Yeah, because it was in the morning, the
Yeah.
operation. Yeah, he came probably that later that day at some point. Again, very kind. And I remember I was worried about my nipple because it was turning a little black and I was so worried about it dying. And he just ran off and got some gauze for it. And my God, really, I was so blessed to have such a great team. And the nurse as well as, yeah, everyone was very kind.
And did he had to do a lymph node dissection or examination as well, correct? And did
Yeah,
he tell you about that? And are you comfortable talking about your lymph nodes?
sure. Yeah.
Yeah.
Yeah, that was probably one of my biggest fears, the lymph node dissection, because I had 10 positive lymph nodes, which is quite a large amount. And so they had to remove, that was a long discussion with my surgeon. I just did not want to have a lot of lymph nodes removed. And he was so kind to just reassure me to say, I'm not going to go crazy in your lymph nodes. I'm just going to do the necessary. And he took 20 lymph nodes. And I'm so glad he did because I, as a patient, I'm I admit it, I was ignorant. I was just so full of fear. If he would have followed my advice, everything would not have been well, because I needed to have a lot of lymph nodes removed, because otherwise, you don't get rid of the cancer. And so fortunately, he did what he needed to do. He took out the 20 lymph nodes.
Because
Yeah,
you were worried about, if you take your lymph nodes out or too many of them out, you get
yeah, lymphedema.
lymphedema, and you're a yoga teacher, you
Yeah.
need fluid, coursing through your body, you need to
Mhm.
do all that stuff. What were your major concerns after you kind of got over the surgery? How long, by the way, how long were you in the hospital?
Just one night.
Just one night.
Yeah.
It's amazing. I mean, the old days, people would be in hospital for a week, 2 weeks, recovering. But you were there for just one night. You had a home nurse that probably came and helped you afterwards.
Yeah.
And what were your thoughts when you got home after this big procedure?
I think it was a big, huge relief that it was over, that I had done it, that it looked all really nice. I was really happy with it, and I didn't have a lot of pain. And I had these weeks ahead of recovery where I didn't have to start yet the so feared chemotherapy. So at that stretch of time where I just could recover. So yeah, it wasn't too bad after that.
And then and how long did you say your physical recovery was from the surgery before you could do some little yoga or stretching, or, I mean, what was it like after that?
That I have to say that was a dramatic change for me, because I used to be very flexible and do quite extreme yoga moves every day as a teacher also. And the impact of having the lymph nodes removed is really big, more than the implant, that also on top of it. But it really restricted my movements a lot, and I had to change my practice a lot in that regard. I had to stop my teaching, which was the most terrifying part of it, because that's my daily income. And it took a long time until I was able to move my arm, and I probably tried too much too early because of the encouragement also of my doctor, I have to say, to get back into my normal life. So I tried a lot too early, probably. Um, and yeah, it's just a big operation, and it does have a big impact on your body. Yeah.
That was major surgery. And again, I mean, if you had a desk job, I could see where going to work, you'd be able to go to work a few weeks later and sort
Mhm.
of push papers around. But you've got a very active, extremely athletic job,
Mhm.
teaching yoga, how many, 3 or 4 times a day at that crazy Ashtanga style where it's very demanding physically.
Mhm.
And then you were shut down and you couldn't work really. And
Mhm.
and your next struggle was really to recover your function, to
Mhm.
heal, recover your function. Um, what did you do that helped you to heal? Is there anything you
Oh,
did?
definitely continue doing my yoga as much as I could. I mean, I'm able to adapt my practice throughout my life. I always did that to whatever happened, and that's a great fortune, because that allowed me to continue to do my daily practice. I never stopped.
You really did? I mean, you
The
got
day
to
after,
that, really?
basically, yeah. I mean, basically the day after surgery, I continued doing yoga, just of
Yeah.
course in a very changed way, but and I think that really helped my recovery, because you need to move and you need the lymph flowing,
Yeah.
and the lymph flow the lymph to find new passages to flow, and all of that I think is accelerated if you do move a lot. And yeah, so exercise I think is one of the number one things I can recommend after that kind of surgery and throughout the whole
And
treatment.
how
Yeah.
was your mood then? Was your mood good then?
Oh no, my mood was definitely, I wouldn't say it was good. No, I mean the whole experience was very terrifying, because it threw me out of my life. As you just mentioned, I couldn't continue going to my office or doing what I did before. I had to, from one day to the next, stop my entire life, and that is traumatizing. And yeah, all the interactions I had with people on a daily basis, I was just all of a sudden on my own at home, not having a job, having a changed body. Yeah, it was a lot to take in. Yeah.
And how did this interact? How did this affect your spiritual practices or your spiritual beliefs?
I distanced myself from my spiritual practice in that time, because I was really struggling so much that I just couldn't go back to that beautiful, peaceful space that I naturally every day did in my meditations, and especially the teachings and interactions with other people. Because I didn't see these people anymore. I didn't teach them anymore. Um, I couldn't bring myself then to this space anymore
So
for a very long
for
time.
you yourself, you just felt that distance. You felt
Yeah.
like what's the word, disengaged maybe, or distanced from the spiritual realm that you tended to gravitate towards and was much a part of your life, I think.
Yeah,
The connection anyway.
I think it was just too painful to go there. That's what it felt like because I felt so sad about what had happened that it was too painful to go to that beautiful space with God and the light. And I honestly, I felt forsaken. I felt, yeah, forsaken, and it was too painful to go there. Yeah, for a very long time, actually. Yeah.
Okay, well, thank you very much for this. It's hard to do this, to speak so openly. And I think that in speaking openly, I hope you can help other people who are going through other medical experiences or other kinds of suffering, which is really the point of all of this. So
Well, definitely.
let's continue another week or two and go for part three, and we can talk about, again, I think the aftermath of surgical recovery. I'm fascinated by your spiritual experiences and changes as well.
Can't wait to talk about that because I always feel I don't want to leave it on a sad note because nice things are also gonna
Yeah.
come out of that, of course.
But it's also natural when you're hit,
Yes.
you've been traumatized, you had major surgery,
Yeah.
your whole life has been changed. These are the times that try our souls, aren't they? I mean, they
Yeah.
really, and everything was changed. And it's natural to feel that, as you say, you were forsaken.
Mm.
It's very poignant. I mean, even Jesus said he was forsaken on the cross. Remember,
Yes.
why
Yeah.
have you forsaken me,
It
right?
felt really like that,
Right? God is,
probably.
he has said that on the
Yes.
cross. So, and that's part of us, our own experiences are connected with that. Okay, thank you very much, and I hope people will tune in another week or two when we give our next episode and we continue the series. And just to keep people up to date as well, you're now uh, this is we're approaching a year from the diagnosis point, and you're two-thirds or through your second round of chemo at the moment. Okay,
Mm.
and I can say you can see you're tolerating it pretty well overall, and we have plenty to talk about in that regard as well.
Yeah.
Okay, so thank you very much. I hope people
Okay.
continue to listen in, and we'll see you next time.